And we are finally back with a new episode following the birth of our third child in a birth center, mind you, and subsequent week-long stay in the hospital due to my wife, Teddy, developing a highly life-threatening infection. More on that a bit later. For now, if you would like to hear a deep dive on stress, its relationship to cancer, and what to do about it, given by the author of one of the few books I recommend to everyone taking an integrative approach to cancer, stick around for this interview with Dr. Lise Alschuler. When our son Ryder was diagnosed with stage 4 cancer 11 days before his first birthday, my wife Teddy and I knew we weren't going to leave anything that could get him well on the table. We've worked with countless doctors and health experts, moved away from our family and friends, raised and spent tens of thousands of dollars, even built a non-toxic house in the middle of the woods, all in the name of healing. Today, Ryder is happy and healthy, and we live more fulfilling lives than before the diagnosis. This is a revolution against what causes cancer and disease, and against what people think about how to reverse it. Whether you're actively healing and want to know all your options, keeping it behind you, or making sure cancer never touches your family, this is your revolution. This is the anti-cancer revolution. From integrative to alternative to energetic, we walk down all paths of wellness, free of bias. My name is Ryan Sternagel. Enjoy the journey. One more time, it's very good to be back, and please pardon the delay in new episodes. If you are on the email list or follow us on social media, you probably know about the events that transpired after we had our new son. If not, that's one reason among many to go to thesternmethod.com and get on said email list and or follow us on a social media platform of your choice so you can be in the know. That said, I'll also get into it a bit after the interview. For now, though, I'm really excited to have this be the first interview we're releasing back in the saddle when we talk about naturopathic oncologists, NDs specializing in cancer, ONC-A&P, the Oncology Association of Naturopathic Physicians, and all that. Dr. Lise Alschuler is without question one of the biggest names in the field. And for good reason, as you'll hear in her bio now. Dr. Alschuler, ND, FABNO, is a professor of clinical medicine at the University of Arizona, where she is the assistant director of the fellowship in integrative medicine at the Andrew Weil Center for Integrative Medicine. Dr. Alschuler is also the founding executive director of TAP, T-A-P Integrative, a nonprofit web-based educational resource for integrative practitioners. She practices naturopathic oncology out of Naturopathic Specialists, LLC. Dr. Alschuler co-hosts a radio show, 5 to Thrive Live, and is co-founder of the iTHRIVE plan, a lifestyle app for cancer survivors. She is co-author of Definitive Guide to Cancer, now in its 3rd edition, and Definitive Guide to Thriving After Cancer. And that book, The Definitive Guide to Cancer, like I said, if you're going through cancer, especially if you're utilizing any sort of approach combining conventional and natural modalities, that's the one you need to get first. And as for the topic, I'm sure you've heard by now, stress leads to cancer, but Dr. Lise also gets into prognostic data on how likely you are to survive once diagnosed with cancer, with or without stress. And of course, most importantly, a whole ton of practical, actionable tips to reduce stress even in the face of a cancer diagnosis. As always, please don't take anything you hear in this episode to replace medical advice, diagnosis, or treatment. Consult your doctor, or even better, a variety of doctors from various disciplines. With that, I will let you get to the interview and see you back here on the other side. I'm really excited to have you on. I've been looking forward to this for a long time. Your book, for those watching, they can see it right here, The Definitive Guide to Cancer, by Lise Alschuler and Carolyn. I've never been sure how to spell her or pronounce her name. Is it Gazella?
Gazella, yep, you got it.
There you go. Is required reading in terms of it, for anyone going through cancer, particularly those going through conventional treatment that want to take an integrative approach and want to make sure they're doing things the right way and not making anything worse or conflicting one thing with another, all that sort of thing. Your book is the very first book that I point people to. And Um, it's, I don't know. I've had other, when I've spoken about your book with other naturopathic doctors, naturopathic oncologists, they, a couple of them have said, "Oh, you mean like her textbook?" And I said, I guess it is a textbook for doctors, but I still, that's not how I even viewed it until somebody pointed it out that maybe it is more of a textbook. But either way, it's just such a handy book to have to when you're wondering really about anything. You can go to the index of that book, and I almost guarantee you, if it pertains to integrative cancer stuff, you're going to find a section on it that's very helpful. So one, thank you for writing that, and two, the reason you wrote it is because you're a naturopathic oncologist, which is a naturopathic doctor who specializes in cancer. Obligatory question: what led you to being a naturopathic doctor who specializes in cancer? Is there something personal there, or it's kind of whenever I have anyone on that actually cancer is their thing, I always want to know what drove it, because it's usually a good story.
Yeah. Well, first of all, thank you for recommending the book. And it is kind of used as a textbook by healthcare practitioners, but it's written in very lay friendly or non-medical friendly terms. So, it's not, I wouldn't call it a textbook myself. But yeah, so when I went to undergraduate school, I had a class that was an elective. And in this class, people who had been diagnosed with cancer would come up in front of this class and they would share their journeys. And some of them were using an integrative approach, others were not. But what was so impactful to me at that young and tender, impressionable age was just how unique these individuals were. I had never met anybody like these people, one after another. There was something that was, just unusually authentic about them. They were courageous, honest. They were living in their lane in life. They were just so unique as adults. And I thought, wow, I want to be around those people. And at the time, I was headed towards medical school. So I thought, well, I'm going to specialize in oncology, because if that's what happens when people are diagnosed with cancer, then those are the kind of patients I want to be treating. And as it turned out, for various reasons, I decided not to go through conventional medical school. I have the utmost respect for conventional medicine, but it really wasn't where my passion was. I had majored in medical anthropology and learned about healing traditions from all over the world, and really expanded my thinking about what health and healing really was. So pulled out of medical school and didn't know what I was going to do. Fortunately, I found naturopathic medical school, and the principles of naturopathic medicine resonated with me 100%. This was about doctor as teacher, supporting the body's innate healing capacity, using the least invasive, most natural ways to support that healing capacity first. Just really good, solid ways I wanted to be a doctor. So that's what started me into naturopathic medicine. I haven't looked back once. I love it. Very passionate about what I do, and but never sort of let go of that idea that I wanted to be more specialized in oncology. And then had the good fortune to be offered a position at a cancer specialty hospital, and was able to work there as both an administrator but also as a clinician. And this was a very unique thing for this hospital to employ naturopathic doctors. And so I got a crash course in oncology and really dove in deep and learned about this whole world of integrative oncology. And again, just found my passion. Haven't left that since. I've left the hospital. I do outpatient care in a part-time way now, but just really love this from and it still is about the people that are diagnosed with cancer and the transformative component that this disease invariably provokes in people. That really keeps me very passionate about what I do. And along the way, I've added my impetus to provide as much as I can for these individuals, because I've had some personal experiences with cancer in my life. My father was diagnosed with advanced pancreatic cancer, and he was given a very poor prognosis at the time. Actually, his cancer when he was diagnosed, was already pretty much everywhere in his body. But he ended up outliving his prognosis many, many fold, and lived really healthfully for the last year and a half of his life. And I attribute that to integrative oncology. And so that really gave me a very deeply personal respect for the power of integrating natural and conventional therapies. And so I kind of went through that. 2 years after I lost my father, I was diagnosed with breast cancer, and really then got to experience this disease from the inside, and myself went through all these conventional treatments, but of course employed natural therapies alongside those treatments. And really throughout my own experience with cancer, yes, I had side effects, yes, I had, challenges, but I always felt like a healthy person. I felt like a healthy person getting chemo. I felt like a healthy person getting radiation. I felt like a healthy person on tamoxifen. And but that's now 10 years ago, so I'm doing well, and really have just taken that experience and brought that forward into my work as well.
Congratulations. I mean, 10 years, that's awesome. That's a big deal. We just passed the 5-year mark with our son, who was diagnosed right before his first birthday, and we just crossed his 6th birthday. And so that was a very, very special birthday. And it's on the one hand kind of arbitrary, because you're never going to really stop doing everything that you're doing to stay well and all that stuff. But
Right.
on the other hand, 5 years, 10 years, both pretty big milestones, especially 10.
Yeah.
That's really, really neat. And it's really neat that you've been able to, well, neat isn't the right word, but there's a difference between someone who's gone through cancer either firsthand or with a close family member, and those who haven't. Even the most well-intentioned practitioners, healers, health coaches, whatever you want to, all of the above. It's just so some things you just can't quite wrap your mind around until you've really been there yourself, and it makes you that much more effective once you've gotten through the other side to be able to communicate effectively with people actively going through it. So maybe that's why you're such a well-known and well-loved and all that good stuff practitioner within the naturopathic oncology community and naturopathic doctor community at large, because you know what you're talking about, I guess. All that being said, you wanted to we were going to talk about stress today and its impact on cancer. And I've certainly had people speak to stress on the show as something that you need to be concerned about, and well, maybe concerned is the wrong word as well, but that you need to be mindful of, and then and really take it seriously, because it is a big deal, and it can play such a huge role in cancer one way or the other. It's, everyone always asks my wife Teddy and I what it was that we think that caused the cancer in our son. And of course, one, we'll never know for sure. And of course, two, it's never just one thing. It's a whole combination of the toxic world we live in and compounding factors and so on and so forth. But the one thing that our mind always goes back to is she was under an immense amount of stress, work-related stress, when she was pregnant. It was one of those situations where the boss was seemingly trying to get her to quit to avoid paying maternity leave. At least that's the best we could figure. And it just really got to her. And I feel bad for this day for not pulling her out. The minute I saw her come home with that look on her face, but she came home with that look on her face day after day after day. And we finally did pull her out much earlier than we were expecting. But yeah, that's one thing that, that we always come back to. And one thing that pretty much everyone that I have on the show speaks to in some way or another is, one, just mindset overall. And that being one of the, one of the common factors, no matter what someone did to get better, what kind of treatments or nutrition or supplement plans or whatever that they were on, that overall mindset was such a big deal. But then within mindset, lack of stress or effective stress mitigation strategies is, something that everyone touches on. And it's really the ultimate irony too, because cancer is the ultimate stressful situation. And then once you find out that stress plays such a big role in whether or not you're going to get better, then that itself is stressful, because then you're not supposed to be stressed out, but that's the ultimate stressful situation, and then that's creating its own stress. So all that being said, I don't want to steal your thunder too much and just ramble on here, but I don't know, do you want to speak on what you found as a clinician and a researcher on the on the clinician side of things, what you have, the importance you have found on stress, and how it can maybe provably lead to cancer or lack thereof, or getting better from cancer or not getting better from cancer. I'll stop rambling and let you talk.
Well, that was a good introduction. So, because there's so many things I want to address in what you said. So the first thing I would say, going back to you and your wife, is, keep in mind that we often create a very linear relationship in our heads between cause and effect. So we look for something that was potentially could have been a cause and it resulted in an effect. But cancer is really not that way. It's, as you said, multifactorial. Even if we were to consider the aspect of stress, keep in mind that when your son was born, the egg from your wife that created half of him was present in his grandmother when his grandmother was pregnant. So the stress that his grandmother was under affected the quality of that egg. And so, there's so many things that we can't really ascribe, responsibility to when we're looking at stress. And I think that that's important, number one, because the last thing that I want to do when we're talking about the relationship between stress and cancer, and there is a relationship, is to make room for blame, self-blame, self-recrimination. That's not what this is about. And there's lots of people, everybody's under stress. If we're not under some degree of stress, given what's going on in the world and how many people there are on the planet and, all the things that are happening around the world, then something's wrong with you. So we're all under stress. So the issue is not, can we get rid of all of our stress? But the issue is to really try to take responsibility for what we can control and to recognize that we have an opportunity to modify that relationship. At some point in our conversation, I'd like to go through kind of what we know about why stress is linked with cancer. But before we get there, I just want to say that the data right now really is pointing more specifically or more strongly to a relationship between high levels of chronic stress and increased risk of cancer progression or cancer recurrence, as opposed to the initial diagnosis of cancer. Now, that may be in part because it's a harder question to study. You have to look back and try to identify stress prior to a diagnosis, and there's so many confounding factors. It would be really hard to tease out that direct relationship. And, there are some indications, like we know that when people experience a significant stressor, a disruption of marriage or a death of a spouse or something like that, the rate of cancer subsequently increases for those individuals. So there's some indicators, some soft indicators, as we say in the research world, that their stress does have a causative role. But again, stress, when people get diagnosed, almost every patient will say, oh yeah, I know what causes cancer. A year ago, right before my diagnosis, I was under this huge amount of stress, and then I got diagnosed. And biologically, that's not really possible that stress caused that cancer, because the cancer cell, the first mutated cell, was really formed in that body probably 10, 20 years ago. And it takes a long time for cancer cells to divide to a point where they're a measurable tumor. So what can happen, though, is these acutely stressful events or high degrees of stress can accelerate what's already present. So I do think that connection that people kind of voice is real, but it's not a causative connection so much. It's more a kind of pushing something faster than it would have gone, which to me is an important distinction, because it takes kind of the blame off a little bit. and just gives now a relationship that we can modify a bit. So I'll stop there. You can ask me more questions before I start to ramble.
That's no, that's really powerful. I've never really thought about it before in that sense. You know, there's, and again, like we keep saying here, polyfactorial, not just one thing. There's, you know, the work of Dr. Hamer, I believe how you pronounce it, in Germany, and of course he was the guy that more or less, I'm probably, you know, oversimplifying it a little too much, but linked all cancer to stress. And he interviewed, I don't know how many thousands of cancer patients, and was able to find the stressful event that caused the cancer and all of them. And I always kind of thought maybe maybe if somebody had a stress-induced cancer, they were more likely to find their way to him, and that might have been confounding the data a little bit. But either way, it's really, yeah, that is something really helpful for people to know, or to bear in mind that cancer, you know, you hear that a lot, that cancer had been growing for X number of years beforehand, that you actually, before you found it. But then you have this other thing where everyone's trying to get you to identify that thing that happened 1 or 2 years ago. That,
Yeah. I just, yeah, I mean, I just want to say that kind of work drives me crazy, to be completely frank with you, because I don't find that empowering at all. I find that very disempowering, actually, you know, to try to trace back and say that stressful event led to the cancer. I mean, what empowerment does one get from that? And those kind of associative relationships are so problematic, because there are many people with huge stressors that don't get cancer. It's not that if you get stressed, you're going to get cancer. It's not that, you know, kind of solid, but it's one factor that definitely kind of tilts the scales in favor of tumor acceleration, because of the various and myriad effects physiologically that happen when we're in a chronic state of stress. And, you know, so the empowerment part of that, though, is that this is all physiology and it's all changeable. So, you know, with stress modification, and we can eventually get to that too, we can start to shift that scale back a little bit. It may not mean that cancer is not going to grow. Cancer may still grow, but at least it's going to be harder for that cancer to progress and to grow. So it's very impactful. So impactful that I used to say, if I was stuck on a desert island, I could only take one cancer prevention tool with me, what would it be? My answer used to be exercise. And now I would say stress management. It's hard for me to give up exercise, but at least I'd take them both on that desert island, because
if you got,
so
if you're on a
impactful.
desert island, you got plenty of space for just some, you know, body weight workouts or
Right.
something. So, yeah, I'd probably agree. Just, I mean, you know, once you start getting into epigenetics and just how powerful the mind is of an influence over the physiology of the body, and you got Bruce Lipton's work with the biology of belief, and on, I would probably agree, especially from a prevention standpoint, and probably even from a I don't know, treatment standpoint, that's it's probably the thing is as mindset overall, and stress or lack of it within that being first and foremost. That being said, do you want to talk a little more on just, you know, what you found as far as, I'll quote your note here, clinical data points on stress as a prognostic biomarker? I mean, what are you finding that leads you to be so confident that, yeah, maybe that's the wrong word, but yeah, just what are you finding on the relationship there between between stress and prognosis, really?
Yeah. Well, so there's been several studies that have looked at the impact of various biomarkers of stress, and then looking as an evidence of stress being present, and then looking at the impact of that stress on outcome. So these are people already diagnosed. So we're talking about disease progression and the risk of death. And for example, in breast cancer, women who have been diagnosed with breast cancer who have metastatic disease, so liver metastases. This is a situation which is very serious, advanced stage of breast cancer. There was a study that divided those women up based on their circadian rhythm. So the circadian rhythm is a measurement that's taken from the level of cortisol in the blood, which corresponds to the activity of the adrenal gland in connection with the pituitary and the hypothalamus, which are located in the brain. That whole axis is called the stress response axis. And we have a normal circadian pattern of cortisol levels, which when it's present, it's like a wave that goes through our 24-hour cycle. It's exactly linked to the cycle of light and dark. And when we have healthy circadian pattern, it's an indication of a very healthy stress response. So we have appropriate secretion of cortisol, and then our cortisol level goes nice and low in the evening. So everything's kind of rejuvenating, and there's a lot of functions in our body that are tied to that healthy circadian rhythm, including there's certain genes in cells throughout our body that are called clock genes, and they only turn on and off in relationship to the amount of cortisol or melatonin, which is kind of the opposite of cortisol in our body. So, and a lot of those genes that are affected by cortisol are involved in things like cell repair, making sure that cells pause in their cell division to do that repair, things that are linked to what we call apoptosis or cell death if the cells sustained damage. So there's a lot of kind of housekeeping functions that are associated with healthy circadian rhythms. So going back to the study, they found that women who had lost their healthy circadian rhythm, so they have what's called a flattened circadian rhythm, meaning that their cortisol levels are elevated all the time. And that's an indication of chronic stress. And that, this is not getting at the cause of that chronic stress. This is just looking at, okay, these women have lost, for whatever reason, that circadian rhythm, their stress axis is not functioning well. They've got a lot of cortisol circulating in their body all the time. Those women, compared to women who had a healthy circadian rhythm, died much sooner than the healthy circadian rhythm. They had a worse prognosis. It was highly statistically significant. They also had less immune function. So some of the ways that we defend ourselves against tumor progression is through especially a group of cells called natural killer cells. And natural killer cells, when there's a lot of cortisol in the body, are not functioning very well. So that was one data point. There was the same exact kind of study was done by Lorenzo Cohen at MD Anderson and colleagues in a group of patients with renal cell carcinoma. These, again, were patients with fairly advanced disease, and they had a fairly limited prognosis. But again, there was a clear separation in survival curves between those who had healthy circadian rhythms and those who had kind of this flattened, what we call hypercortisolemia or cortisol resistance. That same thing was shown in people with colon cancer. So people with colon cancer who had lost their healthy circadian rhythm had basically 400% less likelihood of 2-year survival than people who had healthy circadian rhythms. Huge difference. This has been shown in people with lung cancer who have high stress levels or chronic evidence of chronic stress, respond to treatment less well and have poorer prognosis. So there's really clear data points just on survival, which is, the ultimate kind of holy grail, if you will, of research. And we also know this relationship from other studies that have looked at stress in a different way. So for example, in women who score, so there's various research tools that evaluate somebody's feeling of being socially isolated, and feeling socially isolated is has a very close relationship to being stressed. So it's hard to not be stressed if you're socially isolated. And social isolation is an independent prognostic indicator for mortality from breast cancer. So that means that if you're more socially isolated, you feel that way, then your chances of death from breast cancer are higher. It's about actually 64% higher than if you're not socially isolated. Your chance for breast cancer recurrence, 43% higher. So these are not small little slight differences. These are big effects. That's why I've become very concerned, I think you used the word earlier, is the right word, concerned about the impact of stress.
Yeah.
And we really need to address it first and foremost, I feel.
Couple things. One, yeah, just echoing your social support commentary there. It's that's huge. Like I was just telling you, before we started recording, we got invited to be part of this upcoming Radical Remission documentary sort of thing that is based on the book Radical Remission, and our topic, I guess, was actually social support. And it's kind of funny because we actually didn't have the greatest social support from our family. Was great. We had a few key friends that stuck with us, but our journey was one of finding out who your real friends are, sort of thing, and actually finding out that maybe we didn't have too many real friends, and now we've got, we've made new real friends, or at least maybe until the next big event comes along, and we'll find out all over again.
I hope not.
But what led to everything that we do today, this podcast, the big summits we put on our website, YouTube channel, all that stuff, was Facebook was putting ourselves out there on Facebook initially, just for fundraising purposes. And then that grew into a bit of a community, and we just grew this kind of online support network just out of thin air, and we didn't even realize that that's what we were doing at the time. But it was huge, because then all of a sudden we had hundreds, and then thousands, and then tens of thousands of people that that resonated with what we were doing, and we're kind of pouring gasoline on the healing fire. And it was really neat. So just for anyone listening that maybe that social support comment may have you may have cringed at it or something like that, because you don't have the greatest social support. Get creative, because it is a really big deal. And just because your immediate surroundings might not be the best, it doesn't mean that has to be the end of it.
Yeah, and if we could just dwell on this for a moment, feeling lonely is I think becoming a societal epidemic, and there's lots of reasons for it, but it can be very isolating to be, especially an adult in our culture. And I think that we need to really be mindful of that. And if we're not feeling isolated and we know somebody is, to reach out to that person and to help them to establish some community. But feeling socially isolated doesn't necessarily mean, especially as we're older, psychologists have really analyzed this a lot, and it's not a quantity issue. So it's not about how many friends you have. It's more of a quality issue. So it's how is the quality of your connections with others? It may just be with one other person. It may be how you feel when you interact with the person at the coffee shop every morning. It may be your feeling of connection with your pets. I mean, there's lots of ways to feel connected to the world around you, but it's really, that's what it comes down to. And because I think it can be kind of overwhelming and scary for people if they're feeling isolated. Like, how do I get unisolated? That's not an easy ask. So I counsel my patients about just taking baby steps, and even just looking at what they do on a day-to-day basis and infusing a little more attentiveness and connection into normal daily activities to start to feel more connected and present in the life that we lead. And then from there, looking for opportunities. But so I think it's possible for people to get to a place where they feel more social well-being, and it is really important.
Thank you for elaborating on that, because I started to cringe myself when I don't want people to think that the only way that if they're isolated right now, to get unisolated would be to start this online thing of tens of thousands of people, because our situation is a little unique. Those were much better practical examples of ways to get unisolated. So thank you for elaborating there. And then this may be splitting hairs, but going back to your circadian rhythm commentary,
Mm-hmm.
I was trying to figure. So it makes sense to obviously cortisol is a measure of stress, and I guess the what I'm trying to ask here is, I've never heard of measuring overall stress based on circadian rhythm, but then you're measuring the circadian rhythm based on cortisol levels throughout the day, which makes sense. But I guess what I'm trying to understand is, how do we know if that is stress that, what you think of when you think of stress,
Mm-hmm.
stressors, the external stressors in your life, whatever those may be, versus is it just purely poor circadian rhythm, as in that person was sitting under fluorescent lights watching their big screen LED
Yeah.
TV until the minute they went to bed, and then wake up under those same fluorescent lights. And so, because we've had people talk about the importance of not doing that and not exposing yourself to too much blue light or any blue light after the sun goes down and that sort of thing. And again, maybe this is splitting hairs, but how can you tell there, or does it matter that you can tell if if that person was, if those people in those studies were actually under what you would think of as stress, or just stress purely, and those cortisol levels purely induced by poor circadian sleep habits, if that question
Yeah,
makes sense.
fantastic question. I love it. So let me give you my thoughts on that. So first of all, it's a very fair question, and I think um, we have to step back for a second and recognize that I just talked about one component of stress because it's a tool that can be measured in research studies, this circadian pattern. With that stress response, though, there's sort of two things that happen every time that the stress axis shoots off its hormones and elevates cortisol. There's another aspect of stress, which is related to cytokines. And there's a flood of norepinephrine, epinephrine, interleukin 6, very inflammatory compounds, which are secreted in the body. They should only be there fleetingly, but when people are constantly activating this HPA axis, the level of epinephrine, norepinephrine, IL-6, tumor necrosis factor alpha, all these other inflammatory cytokines start to elevate throughout the body. They actually have longer half-lives than we thought, so they can accumulate in tissues and they start to change cellular behavior. And this has been well documented in a number of cancers. And so the question, though, so I'm bringing that up because I'm going to come back to that. So the question still remains, though, okay, so what? What if the reason for the stress is the tumor itself? Maybe the tumor causes inflammatory cytokines. Maybe that's the source of stress. And so how we feel about life doesn't have anything to do with it. Or maybe it's, like you said, poor sleep habits. So I think, first of all of that is impacting this, and all of that needs to be addressed, which is why we need to kill tumors. Hence my belief in conventional treatments. Hence why we need to pay attention to circadian rhythm and sleep hygiene and our exposure to lights and making sure we get bright light in the morning, all those things, that's important. Rhythm and ritual, all that's important. But we also know from studies that when people who have cancer are put in an intervention, or their social well-being or their stress levels are measured, they can see a change in inflammatory cytokines, and they can see the beginning of the restoration of the circadian rhythm. So so basically what I'm saying is our psychological stress response is a big input into that system. I think there are lots of things that input, but we know from data points when, for example, people who have cancer who have higher levels of social well-being have a much lower expression of these inflammatory cytokines. They still have the tumors. They, might still have the poor sleep habits, but their inflammation goes down because of their social well-being. And we know that people who, for example, begin a habit of mindfulness, whether it's through yoga or meditation on a regular basis, they lower their inflammatory cytokines. They optimize their cortisol levels. And these are people diagnosed with cancer. So there's ways that we can sort of see that, yes, you're making a very important point, that there are lots of factors that feed into this kind of physiologically stressed state. And stepping back from that, a big like fire hose in there is our psychological well-being.
Well, thank you. Yeah. On the one hand, thank you for teasing that out a little bit more. And on the other hand, like I was trying to say as well, does it even really matter? Because our motto was just cover your bases, and anything that may have an effect on progression or causation in the first place, whatever you want to. I mean, you need to be addressing everything. And so yeah, get your sleep hygiene in order, and get your mental wellness in order as well.
Yeah.
Is there, I want to talk about how you counsel people to get the mental well-being under control. Is there anything else you wanted to say on the causation, or the what's the word I'm looking for,
Hmm.
prognosticatory, well,
Hmm.
that's not a word, but either the causation or the yeah, I guess the prognosis side of things before we get into mitigation strategies that we didn't already cover.
Yeah, I want to say something to parents of young children out there,
Why, thank
uh,
you.
which is that there's now also a very clear link between early childhood stress, or what we call adverse childhood experiences, or ACEs, and an adult susceptibility to cancer. And
Yep.
this has been shown in various studies, and the connections between those adverse childhood events and cancer susceptibility are many, but one of the main translations is that when children are little and they experience traumatic things, which can be from, yes, abuse, but it can also be from just marital tension. It can be from moving around a lot. It can be from being bullied. It can be from having a serious illness. Any of those things can kind of do, through a sort of neural programming, kind of hardwire an elevated stress response system. So those kids have a hard time achieving healthy circadian rhythms as adults. And so the message in this for me is that it's really important for those of us who have children to really assess their kind of stressful experiences, and to make sure that we institute, while their brains are very flexible, which is, when they're young, um, as many stress modification techniques as possible. Kids can meditate. It's primarily through guided imagery, but that's a hugely important tool to give our children, and that will impact their health throughout their entire lifespan. Playing with kids and giving kids time to be creative, making sure they get good rest. I mean, all these things are so important for, yes, their health as children, but also their health as adults. So I just wanted to put that out there, because I think sometimes we sort of forget that, a lot of this stuff happens when we're very young.
Yeah, thank you for that. It's when Teddy and I were first going through this, Ryder was one, and so our primary concern was shielding him from as much stress of the situation as we could.
Mm-hmm.
But especially in those first few months, I mean, that was the worst time, worst time of our lives, and certainly just unimaginable suffering and trauma, and in and out of the hospital, and bloodstream staph infections, and
Mm.
can't find a vein after multiple attempts, and got to go in through his forehead, and just all this stuff. And on the one hand, I found out about stress as a prognostic factor pretty early on, and just kind of by common sense, as a
Mm-hmm.
parent, you want to protect your kid as much as you can from this stuff, but then the data also backs up exactly why you want to do that. But then later on, I started to find out about these. I forget if you used the actual acronym that they used for that one big study they had, the ACEs study, the Adverse
Mm-hmm.
Childhood Events Study, I guess it was,
Mm-hmm.
that that tracked these things. And then so that in and of itself for me became or for my wife and I should say, became its own kind of, we're detoxifying him from the conventional treatment that he had, to make sure that doesn't cause a secondary cancer or a recurrence down the road. But then also we're trying to detoxify him
Mm-hmm.
from the stress he went through,
Mm-hmm.
because we want to make sure that wouldn't be ironically the cause of another cancer down the road. So yeah, I mean, I'm looking into getting him into meditation. We do deep breathing exercises. He says what he's grateful for every night. Before he started school and getting up earlier and having to get out the door, and I'm trying to figure out a way to work this into the evening schedule, but we were even starting to learn Tai Chi. He was getting pretty into Tai Chi YouTube videos and all this stuff. And yeah, I mean, I think we're kind of a case study for a lot of parents, even who are not going through cancer, but want to raise healthier children. And that's kind of our big thing is, so your kid doesn't have cancer right now. And thank God for that. But with cancer rates being 1 and 2 or 1 and 3 in adults, I mean, if you're not doing something to stack the deck in their favor, then, you know, you're really not doing something to stack the deck is stacked not in their favor.
Yeah.
And so, yeah, just getting people to think about that early on has been pretty huge for us.
Yeah, and what wonderful tools you're giving your son. I mean, those all sound so lovely, and kids are so resilient too. So, you know, that's changing the way his brain wires, that's changing the way his hormonal system functions. I mean, that's making lasting impacts for him, which is fantastic.
Yeah, and I just found out in his Spanish class. Keep in mind this is kindergarten, but the teacher actually has them meditating for 5 minutes before they start anything, and the teacher, you know, it's kind of well known that her class, she has the kids behave the best in her class. What do you know? Yeah, pretty good stuff. Yeah, all that said, I'd love to dive in a bit more on how you advise, how you went through yourself managing that stress, and then what you've learned from there, and how you advise your patients in the present day on how to get a handle on this stuff.
Yeah. So I guess I usually start with kind of helping people, encouraging people to step back and look at the bigger picture. And I did this myself when I was diagnosed. Like, where is sort of identifiable stress coming from? What's not in alignment? And, you know, for me, I was in a job that I loved, but it was not the right job for me at that point anymore. And it was causing more stress than not. And so I had to make a major career change at that point. And that brought me into greater alignment and kind of work-life balance, and really just took my stress level from a 9 to a 4. You know, I mean, that was huge for me. I also got a puppy at that time, and my partner and I found the unconditional love of a puppy, which was unbelievable. Brought my stress level down even more. Just, you know, for me anyway, having a dog just anchors life in a way that nothing else does, because you have to plan around his or her, in our case, her bladder, and you know, you get out and walk every day in nature. I mean, there's just so much that's positive with that. But I think, you know, just the point being to really just step back and say, what can I change in my life that will help me to be more of who I am, to bring more of myself into this world in a way that feels good and positive. And then, of course, once that's sort of in process, I think that there are some daily things, some even all the way down to supplement things that we can do to modify the impact of stress, which are important as well. I almost always start with sleep. You mentioned it. And I think because so much of our stress response system, so much of inflammation happens when we're sleep deprived, either because we're not getting enough hours of sleep or we're not getting enough quality of sleep. It's just an impediment. So until sleep is really solid, it's going to be very difficult to alter the physiology of stress. And so I spend a lot of time talking with patients about their sleep. You know, are they getting enough sleep? Do they wake feeling rested? Are they waking up in the middle of the night with trouble falling back asleep? Talk to them a lot about what we call sleep hygiene, which you mentioned as well. So, you know, is their room dark and cool? Are they not using their electronic devices? Or if they are, do they have a blue light shield? I mean, all these things are important. And then, you know, when they wake up, do they get light exposure? That's so important. There's been some really interesting studies actually just using a light box for people diagnosed with cancer and going through treatment, and their fatigue level goes down after about a month of using a light box, which is a clear indication that they're starting to normalize that circadian rhythm. And I think so many of us, especially in the winter when it's usually dark when we get up, dark when we get home, we just don't see light very often. And that's just hard on our body, really hard on our body. So those kind of things I talk about. And, you know, the master controller of the circadian rhythm is a hormone called melatonin, which is secreted throughout our digestive tract, but also in our brain. And in our brain, the pineal gland will, the pineal gland secretion of or release of melatonin is held in suppression when our eyes are exposed to light. And then as soon as we hit dark, that repression is released and melatonin is released. And that helps us go through the sleep cycle, and it helps us get that circadian rhythm. So melatonin is often deficient in people who have chronic disease. And we can, to some extent, reinstate that through healthy sleep habits, but I often will supplement melatonin to, in some ways, compensate for the lack of melatonin. But it's also been shown that when people take melatonin, their own production of melatonin starts to improve. So it's also a direct way to support melatonin production. And
would that be, I hate to break you mid-thought, but is that short-term or long-term? My pause in melatonin supplementation has always been, it just seems like I always hear about pretty much anything that you supplement with that the body naturally produces, then if it's on somewhat of a long-term basis, then you're kind of working backwards or shooting yourself in the foot or whatever you want to call it, because then you're training your body not to produce it. So that was very interesting to me to hear that bit about it actually having the opposite effect.
Yeah, I mean, I think that can be true for some things. That's also more of a belief than a fact. And I think with melatonin, what we know, for example, is it has a very short half-life. So when we take melatonin, it's around, but not around very long. So it doesn't have the opportunity to really do things that would cause us to habituate to it, which is, if you ask anybody who takes melatonin regularly, let's say for its anti-cancer properties, which is another aspect of melatonin. Let's say they sleep fine. They just happen to take melatonin because they're looking for its anti-cancer actions. If they stop taking it, they still sleep fine. It doesn't affect their sleep one way or another. So it's sort of an indication. What happens is the pineal gland is very prone to oxidative stress. And so I think one of the theories is that as we live in this oxidative world with all our environmental toxins and so forth, we get oxidative stress in our brains. And the pineal gland, when it gets oxidative stress, it can lose the ability to produce and release melatonin. So melatonin is a very potent antioxidant, crosses into the blood-brain, through the blood-brain barrier. And one of the theories is that it helps to restore the health of the pineal gland, literally re-enabling it to make and secrete its own melatonin. And, you know, I think the only risk, and this is not studied for long-term melatonin, taking long-term melatonin, is that it could theoretically, when the body has a lot of something, you know, hormones only work when they're bound by a receptor, which is sitting on a cell membrane or inside the cell. And if there's a lot of something, cells sometimes say, okay, that's enough. I don't need that anymore. And the receptors become resistant. This is what happens with insulin resistance. This is what happens with high cortisol and cortisol resistance. And it could theoretically happen with high long-term melatonin, some melatonin resistance. But again, that's a bit theoretical. That hasn't actually been documented yet. That being said, you know, I have that in the back of my mind, and certainly people who are on long-term melatonin, encourage them to take breaks every now and then, adjust the dosages over time, just to sort of manipulate that potential biochemistry.
Very good. Yeah. And that, I guess, kind of falls in line with our philosophy on long-term supplementation in general. It's easy. I mean, just from an anti-cancer standpoint, when you first get that diagnosis and you find, oh, this looks like it would be good, we'll take that. This looks like it would be good, we'll take that. and then you add like 50 different things, but then well, am I supposed to just stay on these 50 different things
Mm-hmm.
for eternity? And that's going to get really expensive, but then also it isn't even the best, because then you're kind of developing a resistance to
Yeah.
each of those things long term. So I try to, we try to categorize things best we can, and then rotate through things within those categories. And so we're sure we're kind of covering all of our bases, but we're still not getting stale with anything. So that's probably applies pretty well to anything that you might be scared of getting resistance to.
Mhm.
Is just kind of rotation, and just don't do the same thing all the time. But yeah, that's good to hear about melatonin. I've always there's a few studies on neuroblastoma and melatonin in particular, which is what my son went through. But I'd always kind of shied away just from that long-term health versus short-term
Yeah.
gain perspective. But maybe I'll be a bit more judicious, or a bit less judicious, I should say,
Uh-huh.
and rotating through melatonin and feeling okay with it. I'm glad to hear, especially since he's been sick the last week. I've given him melatonin a few nights in a row, and even that has been like, oh, I don't know if I should be doing this. But
Yeah, I think that's fine. Although with kids, I think it's probably anything that has a hormonal is of the hormonal category. I'm always a little bit more conservative with
yeah,
kids. So I think your philosophy of just occasional, more short term rather than long term makes sense to me.
very good. Yeah, that being said, like I said, I kind of cut you off midstream on one thought, but please continue on just the mitigation strategies.
Oh yeah,
Extra
gosh.
large.
So there's so much. So let me actually move if I can. So sleep support. There's lots of other supplemental strategies and botanical strategies for sleep support. I'll leave that aside for the moment, but just know that there are many ways that we can optimize people's sleep without having to use sleep medications. Because I think sleep medications are really something to be avoided for people with cancer, not only because they're associated with increased risk of cancer, but they also really don't create healthy sleep cycles, which is where our restoration comes in. So I'm really a firm believer in using a natural approach for sleep optimization first. So let's say we've got the sleep taken care of, we've got life aligned. The next thing I talk to people about is exercise, and exercise is not for its own reasons incredibly important for reducing the risk of death from cancer. And regular, daily, vigorous exercise is, what we're learning. As we started to get more data on exercise, the recommendation, and it really is still widely circulated, as 30 minutes of a brisk walk at least 5 days a week. And that's really where the benefit of exercise begins. But that is just the beginning. So really the impact and the potential impact for exercise comes when people are at the edge of their fitness, and they're always at that edge, and that edge is going to change as they exercise, but they're always at the edge, which means exercise is always fun but never easy. And so I really counsel people about working in more vigorous aerobic activities if they're able to, alternating that with some strength building. When they make a bicep, their muscle should feel firm and strong. If it's flabby, then they know they need some more work there. I mean, these are important because exercise is related to stress specifically, is when we exercise regularly, we have a healthier circadian rhythm, and that's been very clearly shown. We have fewer inflammatory cytokines, which are one of those cancer promoting aspects of chronic stress. We have healthier immune systems. Chronic stress suppresses immunity, so we counter the immune effects. We have healthier blood sugar control. One of the other things we haven't even talked about, but that goes along with chronic stress, is elevated blood sugar and a predilection for insulin resistance. Well-toned muscles are one of the best ways to downregulate insulin resistance. So it really touches on every aspect, and you can tie all those aspects back to stress too. So exercise is kind of the next thing I work with people on. And there's lots of individual cultural hesitation for people around exercise and getting really into it. So it sometimes takes a while, and we just take it a step at a time, but it's really important.
What would you say to the person going through conventional treatment that feels like garbage, and exercise is maybe the last thing they want to think about?
Yeah, so when I was going through chemo and radiation, I exercised throughout my treatment, and I, maybe did my kickboxing workout with less intensity, but I still did it. And, that kind of thing. But I talk to people about a general rule of thumb, and this is, I guess I should give the caveats to people who are seriously cachectic, so that they've lost a lot of muscle mass. They actually do need to exercise, but they would do better with things like Tai Chi, yoga, walking. But short of really serious health compromises, a general rule of thumb for people when they're in treatment is that their recovery time after exercise should always be, or should be no more than half of their exercise time. So if they exercise for, let's say, 30 minutes and they're tired when they're done, after resting for 15 minutes or less, they should get their pre-exercise energy back. And if it takes them longer than that to get their recovery time or their pre-exercise energy level, then they've probably overdone it and they should back off a little bit. But that sort of helps people gauge in a very, non-sophisticated way, how to kind of modify exercise to where they're at.
Very good. Very good. I like to, I don't know if this is sound or not, but I usually like to point people to like rebounding, jumping on a little mini trampoline. I mean, it's, lymphatic system improvement, all that stuff that you hear about, but it's also a really good way to control how hard you work. You can do little jumps or you can do big jumps.
Yep.
And you don't even have to be that like physically capable to just get on and bounce on the thing. But it's a good, you get a good workout in without having to really exert yourself in a way that would, that you might think would be not pleasant.
Yeah, I think that's a great idea. And they actually make those now with handholds.
Yep.
So they're very safe for people. And I learned this from a patient of mine who was at a time in her treatment where she was just really exhausted. She couldn't use her rebounder anymore. She's too tired to do that. But she discovered if she sat on one of those big Bosu balls, those big kind of balls that people use, she could actually bounce kind of sitting, and that she could do. So she did that until she gained her strength back enough to go back on the trampoline.
Very good. What outside of exercise?
Okay, so let's move to diet a little bit, because diet does make a difference. And this is just very straightforward and I think should be fairly intuitive for people. But there's a clear correlation between eating a Mediterranean or anti-inflammatory style diet and lower levels of stress hormones, lower levels of inflammatory cytokines. People who eat a plant-forward diet that's devoid of ultra-processed foods and rich in plant foods tend to have more resilience to stress and are more easily able to manage their stress. So that becomes just a very nice thing to do. Conversely, we know that people who eat a lot of refined sugar, actually that refined sugar acts as a stressor. So they get more activation of their stress response. So it's just kind of another push in the direction of a good, solid plant-based diet.
What do you know? Tell that to the carnivore people that are more and more popping up on our Facebook page, telling us that we're poisoning our children by feeding them too many plants.
Yeah, I just really don't get that. And and I was very specific with my language. I said plant forward, plant based. I didn't say vegetarian. So I don't actually think that I don't think vegetarianism is the right diet for a lot of people. Some people do need to eat some amount of, or they not need to, but they feel better when they eat some flesh. But the majority of the diet should be plant-based. I mean, the science is behind me on this, and behind you, it sounds like, on this. And it's very difficult for, I think, especially in the lens of cancer, to make a strong argument for a heavily meat-laden diet, because too much meat is a carcinogen.
People do try. All that being said, but what do you know? Lots of plants helps with this aspect of cancer, just like it helps with just about every other aspect of cancer. Well, what do you know? Yeah, what else on that? I don't think we need to belabor that too much.
Okay, let's talk about some specific plants in the context of herbal medicine, because I think there's a really interesting role to play here. So I always try to go for a 2-for-1 if I can. So in other words, is there something that could help manage the stress, but also maybe has some direct anti-cancer actions or potential to have some anti-cancer actions. So one of the things that comes up for me in this regard is actually using, making sure that people's intestinal microbiome is diverse. So sometimes that's prebiotics, which would be high fiber, cultured foods. And for some people, that's actually taking probiotics. And the more diverse our intestinal flora is, the less anxiety we feel, the better stress response we have. And that's now associated with better immune function and better response to a lot of conventional treatments. So that's, I think, very foundational. The other thing that I think about in this regard are there's some plants that are in the category of adaptogens. I don't know if you've talked about adaptogens on your show much, but these are plants that have the ability to reinstate the circadian rhythm. And there's very specific mechanisms that have been discovered. I won't go into that. But these are plants like like American ginseng, for example, or ashwagandha, or holy basil, rhodiola. These are all examples of adaptogens. And many of these plants have been shown, not so much in clinical studies, but in preclinical studies, to impede the ability of cancer cells to grow and divide. So they appear to have some anti-cancer actions. They definitely have immune supportive actions, and they have anti-inflammatory actions, and they help modify blood sugar, all of which collectively will lower the risk of cancer progression. And they're one of the best ways to regain a healthy stress response system. People who take adaptogens typically feel better too. There was actually a study where they gave people going through cancer treatment an adaptogen called Panax quinquefolius, which is American ginseng. And it was a 2-gram dose. And they gave it to them for a couple of months, and they found that the fatigue levels significantly improved in the American ginseng group. And that was an example. It's an example of what somebody will experience when they take adaptogens. So those are things I use a lot in my practice.
Yeah, FYI on that note, we're the opposite on this show of a brand averse CME presentation or something like that. So, I mean, if you have any particular formulas that you like in specific, I always love finding out about new products and that sort of thing. Not saying you have to name something.
Yeah, I mean, mostly I would just say it's really important with botanicals to go for quality. And to make sure that the brand that you're getting is very top notch. So I don't know all of the brands out there. I used to have a job where part of my job was to do audits of manufacturers of dietary supplements. So I've done probably, I don't even know how many, between 20 and 30 audits. So there's a good set of brands I know very well. And so, for example, for these adaptogens that I've mentioned, I'll give you a couple of companies that I know have very high quality products. Gaia Herbs is one, Vital Nutrients, and they have that's a practitioner brand, meaning it's typically available through practitioners, but they also have a consumer brand called Verified Quality. Pure Encapsulations. There's a product by Integrative Therapeutics called Cortisol Manager, which works wonderfully for people that's taken at night. It's kind of an unusual adaptogen formula. Their Solar Ray actually is exceptionally good quality, and there's lots of, they're coming out with an herbal line soon. So, I mean, there's lots of brands that are available, but I think the main criteria for me is quality.
Very good. I'll just let you keep going until you
until I exhaust myself. Let's see. Well, so I guess I want to just say 2 more things. I'll stick with herbs for a second. And that is that with stress comes anxiety. So people tend to have some chronic, maybe mild, maybe moderate, maybe severe anxiety. And it's really important to try to get a handle on that through a supplemental perspective. There are some things that I really rely heavily on in my practice. One is a compound called L-theanine, which is an amino acid. So it's kind of a protein molecule. It's originally extracted from green tea, but you'd have to drink like a vat of green tea to get enough L-theanine. So you really can only get therapeutic doses by taking L-theanine. The only branded ingredient that's been clinically researched is something called suntheanine. And you'll see suntheanine in a variety of different brands. So it's not the end manufacturer, but you'll see it on the label of many different manufacturers. But suntheanine has been shown very clearly to reduce anxiety. and help people sleep better. Really just gives them and it works very quickly. So it's kind of a good thing to start with. And then my next favorite is lavender extract. And you can use lavender lots of ways. Dried lavender flowers in a little sachet under your pillow. You can even drink lavender tea. The form that I use is something called Selexin, which is another branded ingredient that's been clinically studied mostly in Germany. At least 400 clinical trials have been done on this Selexin product. And to my knowledge, it's only available through Nature's Way or Integrative Therapeutics. But that particular product I've found to be unbelievably reliable. And the studies show too that about 3/4 of everybody who takes it feels less anxiety, and pretty soon after they start. And then, of course, I want to finish with perhaps the most important aspect to stress management, and that's mindfulness. So mindfulness can be a scary word for people, but it starts, and you mentioned this earlier, but it starts with just breathing exercises. If the only thing somebody does is implement breathing exercises on a daily basis, I guarantee that they will experience some degree of stress relief. Dr. Andy Weil has a technique that he talks a lot about called the 4-7-8 breath. And basically, you take an inhalation counting to 4, and then you hold your breath counting to 7, and then you exhale counting to 8. And you repeat that. So 4-7-8. And you will find after about the third cycle of that, you just will feel more relaxed. And if you do that on a daily basis, your whole perspective on life will change. It's actually pretty amazing. So that's something like that's super easy. And then, of course, I'm a big fan of meditation, and that's become so much easier now because there are some great apps that people can download on their smartphones. And most of those apps have 10-minute meditations, which, again, I think most people can squeeze into even a busy day. And so they're guided meditations, which makes it a little bit easier for people. And that has tremendous impact on people's well-being. So I think that, meditation and breathing is really a good place to start. And then you mentioned Tai Chi. That's kind of a moving meditation. So for people who just can't sit and meditate, doing something like Tai Chi or a gentle form of yoga or Qigong can be unbelievably helpful as well.
Yeah, and the research certainly backs you up on all of that. It's not it's common sense on the one hand, but then on the other hand, like actually, I think I saw you there, not the Society for Integrative Oncology conference that just happened in New York, but the one that happened last year in Scottsdale, was it?
Yeah,
Scottsdale.
yep,
That's the first time I'd been to that conference, and I couldn't believe the amount of research that had been done on, all of these different mindfulness practices related to cancer and cancer survivorship and as a whole, and then the quality of life in particular. I think it was really neat because that's a particularly integrative conference, and pretty much everyone there is talking about blending conventional treatments and natural stuff at the same time.
Yep.
And just the amount of data there was on people going through conventional treatment, implementing these practices or not, and what a difference that makes in their quality of life in particular was just overwhelming. What else did I want to say? Oh, also on the meditation note, yeah, just for anyone that has yet to get into it, also wanted to note that there are look into the different types of meditation. Like, there's the apps those apps like Headspace and Calm and those sorts of things they're guided meditations, but they tend to be mindfulness meditations. And then you can start to think that's kind of the only type of meditation. I've actually tried those apps for years and still didn't find myself being very, I just still wasn't very happy with my proficiency in meditation. But then recently I went through a transcendental meditation course, and like after a week of doing that, I feel like I'm better at it than I was after the years of trying the mindfulness style. So just another tip for people is if you're not getting it with whatever you first get into, just kind of expand your horizons and see what else is out there for you. And like you said, Tai Chi is a whole different type. Yeah.
I'm so glad you said that too, because I recently learned about loving kindness meditation, which is yet a different kind of meditation that focuses on kind of giving yourself loving kindness with various body parts, and that's totally cool and would work for some people and not for others. So I love that you're recommending people to explore. So important.
Very good, Dr. Lise Alschuler. This has been amazing. Is there anything, any parting thoughts, or just anything you had on your mind or heart today that we didn't talk about that you wanted to get in before we get out of here?
Yeah, I'll just finish by saying that, this can be kind of a delicate topic. I think we addressed that a little bit in the beginning, but this is really not about blaming yourself. And I think that, yeah, we can look in the rear view mirror and see, maybe identify some stressful things in the past, assign some responsibility to that is only helpful if it serves us moving forward. And I think the real opportunity in recognizing this relationship between stress and, in this case, cancer, is that this is something we are empowered to make changes about. I just addressed some, and there are many ways that we can impact how impactful the stress in life is on our health and well-being. So I really see this as an opportunity for people more than anything. And with that, I also just want to thank you for hosting the show. I love that you're doing this work in the world. I think it's so important. You're hopefully spreading good knowledge and empowerment to people with every show, and you're just doing a great job. So thank you.
We try our best. It's a labor of love, and it just, it came out of begging doctors for 15 minutes of their time here and there, and then realizing I could just start a podcast and get to pick their brain for an hour at a time. So yeah, which has been great doing with you here today. And on that note, please one more time, from my end, The Definitive Guide to Cancer by Dr. Lise Alschuler. Please go get that wherever fine books are found on Amazon or wherever else.
Yeah.
It's really quite the resource to have at your disposal. That being said, I just found out recently that I don't know why I didn't know this before, but you have some sort of radio or podcast type of thing yourself. Please note any other social media or whatever you want to say about that, your practice in general. Do you work with people remotely or just in person, and anything else?
Yeah, so I co-host with my co-author, Carolyn Gazella. We have a show called iTHRIVE Live, and it airs live on a internet station called W4CS.com every Tuesday at 7 p.m. Eastern time. But really, the way most people listen to it is as podcasts. So we're on iHeart, Spotify, Apple, iTunes. What's the other one?
Stitcher.
Yeah, stuff like that. So that's something that people are encouraged, welcome to listen to. And then the other thing that Carolyn and I have created is a survivorship program that's very personalized, and it is offered free through the American Institute for Cancer Research, or AICR, which is a tremendous nonprofit organization that has really been at the forefront of exploring the relationship primarily between nutrition and cancer. And they are in partnership with the World Cancer Research Foundation, so big organization. And if you go to their website, aicr.org, and you click on Survivor Plan, you'll see the iTHRIVE plan. You can sign up, use it free, and it will help kind of give you daily little baby steps in the areas of diet, exercise, or what we call movement, rejuvenation, resilience, stress, or spirit, and so it's an environment. So it's kind of a cool labor of love, and available to people. And my practice is unfortunately very limited now. I have only a half day of practice because my full-time work at the University of Arizona Andrew Weil Center for Integrative Medicine takes most of my time. So I really can only take new patients who come with a referral from a physician. However, I work with two fantastic naturopathic oncologist colleagues, Dr. Melissa Coates and Dr. Dan Rubin, and they have full-time clinical practices, and they also offer remote consultations. So that practice is, you can get more information at listenandcare.com.
Yep, that's Dr. Rubin is one of the first stops I point people to as well. I didn't realize you were that far removed from practice. It's well, I'm glad you're out teaching other doctors and sharing what you know. That's another what I consider great in the field was or is Dr. Paul Anderson,
Hmm.
and he was we didn't know at the time what a big deal he was, but we lived in Seattle when our son was first diagnosed, and we got pointed to him just kind of on the tail end of when he was actually regularly seeing patients, and but now I'm glad that he's out spreading spreading his knowledge to other doctors as well, because
Hmm.
it's an important thing to do for people that know as much as you and he do, for sure.
Yeah.
Very good. Dr. Lise Alschuler, this has been incredible. Thanks again for coming on the Anti-Cancer Revolution.
Thank you. Appreciate it.
There you go. There is indeed a reason she's such a big deal, and I hope you're a little less stressed after listening to that interview with the one and only Dr. Lise Alschuler. By happenstance, I got invited to hit the slopes with a group of people in the health world yesterday, and when a gal in the group heard what I did, she asked if I knew Dr. Lise and proceeded to tell me she had been instrumental in getting both of her parents through very rough cancer diagnoses. So there's that for you. As always, the show note summary of everything we talked about in today's interview, along with links to everything mentioned, most notably the latest edition of Dr. Lise's book, The Definitive Guide to Cancer, can be found at thesternmethod.com/Lise-Alschuler, Alschuler. And yeah, if you were following the whole ordeal, thanks for your prayers. After our new son Rocky joined us on December 19th, by the 21st, my wife Teddy was going downhill in a big way. Once we finally decided it was an ER-worthy thing, turned out she had sepsis, a group A strep uterine infection that had gone to her blood. 1/3 of women in that situation do not make it out, and the infection was not clearing after several days of hardcore antibiotics. But we were continually adding natural stuff as they were adjusting the antibiotics, and we finally got through it. That and our son Ryder clearly got the fighting to stay alive genes from his mom. Didn't know we needed another chapter in the book, but we got one all the same. And I'll also note this has been another instance for us in which we're grateful to have access to both conventional and natural medicine. The conventional system in itself is pretty messed up, to say the least, but there is certainly a time and place for the medicine it has to offer. I'll get out of here with that, but not to worry, we're back in action, and you can expect another episode out of us very soon. As always, if you're going through cancer or any other life-threatening situation for that matter, just keep going. I'm Ryan Sternagel of The Stern Method. You have been listening to the Anti-Cancer Revolution. God bless and Godspeed.